Hello all, this is Dr. Kaustubh Mohite, your pediatric pulmonologist. And today we are going to talk about yet another important topic, that is community-acquired pneumonia in children. In order to make this topic easy to understand, I have divided this into 3 subsections. So now we'll be taking care of the first subsection, which is the introduction and the pathogenesis. So pneumonia is a term which originates from the Greek language, which in true sense means lung disease. So what exactly is pneumonia? It is the infection of the lung alveoli as well as the bronchiolar epithelium. So the main things that I've seen in pneumonia is bronchiolar swelling, the inflammation of the alveolar wall, as well as the alveoli being filled with fluid because of all these inflammatory byproducts. So as every single disease, we know that there is interaction between the host, organism, and environment. Similarly, in pneumonia, the host factors are being compromised, and along with that, the overwhelming organism load causes these conditions. So why does this pneumonia doesn't happen in every single individual having these organisms is mainly because of these 4 factors. The first being the anatomical and the mechanical barrier. Any particle more than 10 microns is being filtered by the hair of the anterior nares of your nose. The synchronous ciliary beating clears the entrapped organism by expulsion or swallowing. The intact epiglottic reflex prevents aspiration. Also, the acute angulation at which the central airways branch entraps most of these large particles. Second factor is the humeral immunity. The secretory IgA has both antibacterial as well as antiviral properties. The IgG and IgM acts by opsonization of the bacteria. They activate the complements and neutralize the toxins. Finally, the immunoglobulins, fibronectins, and the complements eliminate particles that reach the terminal airway and epithelium. The cell-mediated immunity is mediated mainly by the lymphocytes, and these have 3 critical roles in production of antibodies, cytokines, as well as they have their own cytotoxic activities. Finally, the phagocytic cells. The 2 populations of phagocytic cells present in our body is the leukocytes, which are present in the blood, as well as the macrophages, which are present in the alveoli, intravascular spaces, as well as the interstitial spaces. So these macrophages, which are responsible for engulfing and eliminating the organisms in case of disease state, are the ones which secrete cytokines like tumor necrotic factor, interleukin 8 and interleukin 1, which are the sole reason for inflammatory processes in the lung. So the invasion of organisms in the lower respiratory tract triggers an immune response and produce inflammation. The alveolar spaces get filled with white blood cells, fluids, as well as cellular debris, which further reduces the lung compliance and increases lung resistance. The obstruction of these smaller airways could be either partial, which leads to air trapping, or complete, which leads to complete collapse of the subsegment. This further alters the ventilation perfusion ratio. In case of severe infection, this further leads to necrosis of the bronchiolar epithelium as well as the pulmonary parenchyma. So typical pneumonia passes through 4 stages, that is congestion, red hepatization, gray hepatization, and finally resolution. So in congestion, multiple bacteria are seen in the alveolar luminal surface, which attracts various leukocytes as well as red blood cells. These leukocytes secretes a lot of cytokines, which further increase the inflammatory reaction in the localized region. This further leads to alveolar wall thickening and a lot of fibrinous exudate. Finally, these organisms have been engulfed and killed by these neutrophils, and finally the debris is being cleared by the macrophages. So that's all for the introductory part and the pathogenesis of community-acquired pneumonia. In the coming next session, we'll be talking much more practical that involves case-based discussion, the etiology, clinical features, and diagnostic tests. Thank you.